We are very happy to join you today. First of all, today's topic is going to be about nursing courses. It is going to be a masterclass session because we are going to discuss about all aspects of nursing admission, no matter at what level you want to study, be it at a diploma level, be it at a bachelor's level, if you are an overseas nurse, if you aspire to study Masters of Nursing. So we are going to do a 360-degree review of the admission process so that you can crack the admission requirements, because we all know, right, Hina, every student wants to study nursing nowadays.
Yes, absolutely. Every day we receive multiple inquiries.
Yes.
With different cases asking for the solution. So we are here to help the students. So you can take maximum advantage here for
Yes.
us.
And
Yes.
for our viewers, just a little tidbit here. So whatever is your personal situation and you have questions when it comes to nursing admissions, please drop your questions. This session is being streamed live on YouTube, on Facebook, and on LinkedIn. So you could drop your question in the comment section and we will get to it at the end of the session, and we'll make sure to answer all your queries. So why do you think, there's a lot of interest when it comes to nursing courses recently?
This is very popular, I believe, and due to COVID and the requirements of PR, and so
Yeah.
that has been increased recently. So
Yes.
I've been receiving so many queries every day asking for the solution. I don't have IELTS, I don't have this, I don't have that. How can you assist us? And here we are to help those kind of people.
Yes.
I think I would start with Diploma of Nursing
Yes.
first,
Yes.
Deepa, because this is the best way to bring the people, let them know how can you take from the basic.
Yes.
Yeah.
Yeah.
So for example, many students ask us that I don't have 7 each.
Yes.
So do you have any idea how they can still proceed? Is there any pathway for them?
Right. So yes, now English language requirement is very important when it comes to any healthcare professions. Why? Because you are going to be working in the Australian healthcare system. You're going to be dealing with patients. It is very important that you have good communication skills, good written as well as verbal communication skills, because these are high stake things. You can't get them wrong. So universities, education providers, and the registration authorities like AFRA, as well as skill assessment authority like ANMAT, they're very right in sticking to a really high English requirement, 7 each, no bands less than 7. Or when it comes to PTE, it is 65 bands overall, no communicative skills less than 65 as well. But that is not the be all and end all. If you're struggling, there are options where you can start your nursing course, but you have to be aware that at the time of your registration, where you are going to get your registration as an enrolled nurse, or at the time of your skill assessment, you will definitely need that 7 each. So students who are just missing out by 0.5 bands, so we have many students who come to us and say, I've been trying for my 5th time, 6th time, I still haven't cracked it, but I aspire to become a nurse. I want to start my nursing course subsequently. There's an option for students where they don't have to wait that long. You can study Diploma of Nursing. In the meanwhile, you can be in preparation for your English. Right? Because Diploma of Nursing is anywhere between 78 weeks to 104 weeks. So that is a huge amount of time, 1.5 years to 2 years. Correct. During that time, you can pick up, as long as you are using coaching services and self-prep, if you're putting enough time in that, then you can pick up those skills. So if you are losing out by 0.5 bands or 1 band here and there, then you don't have to let your dreams of studying nursing stop. What you can do is you could enroll with a few providers who are allowing this. You can study with a Diploma of Nursing with full cognizance that you would still need it at the end of the course. But while studying, you can be in preparation for it, so that while you have your Diploma of Nursing completion, if you have your 7 each, which is across 2 sittings, by the way, you don't have to crack it in 1 sitting, then you can get your qualification as well as your enrolled nurse registration. Just to set the viewers a few basic terminologies around it, right? If you study Diploma of Nursing, you can qualify, your career outcomes will be an EN, and you can qualify for PR pathway as enrolled nurse, EN. And if you study at a higher level, Bachelor of Nursing, then you will be qualifying as a registered nurse, which is a hierarchically level higher compared to an enrolled nurse. So guys, if you are struggling to with your 7 each requirement. You don't have to make that a limitation. You could be a work in progress while you're studying this course.
This is actually very good, Deepa, because I have seen people, they were really ready to start the course, but due to the entry requirements, they were not able to do it. But now you can do it. You will have time until you complete that course and then apply for the skill assessment. So it's a golden opportunity for you guys. If you're interested, you can bring your information to us and we can help you how to get the admission.
Right.
For the students, Deepa, who are not on a student visa yet, they are on their bridging visas, maybe applied for AAT or maybe applied or 485 visa. They still want to study nursing. Do you have any entry criteria flexibility to them?
Yes. So if you're a non-student visa holder, you could still study diploma of nursing. Yes. And even in that situation, if you don't have 7 each, you could still study the diploma of nursing as long as you're working on your 7 each. There are a few providers that are allowing for non-student visa holders. If you can be on your TR. Many students have a primary PR pathway, like they would have studied accounting. They've exhausted their options because very really high point requirements, and they're trying to crack into nursing, but still they are attempting their 7 each, but they are not also on student visa. Then as long as they take full cognizance of the fact that they would need that 7 each at some point at the registration level, at the skill assessment level, then they can start. Even if you're on a 485, if you're on a 482 visa, you're on a 482 dependent visa, or you just have a bridging visa A with study rights, you could still be doing this without your 7 each. There is also one more pathway that I want to introduce to our viewers. Let's say you are you want to study the diploma of nursing, or the Bachelor of Nursing as a pathway, but you still don't have 7 each. Then the another option is to also do the Diploma of Health Sciences leading to Bachelor of Nursing, because the Diploma of Health Sciences has only a 6.5 requirement, which many students have. But if you score really well in your Diploma of Health Sciences, get a really good WAM score, which is your aggregate or your weighted average marks, to be above 70%, then you can get 1 year credit into your Bachelor of Nursing program. So 2 kinds of options available. You can either study Diploma of Nursing with 7 each or without 7 each, or you could study Diploma of Health Sciences leading to Bachelor of Nursing. These sort of courses are available with La Trobe University as well as Southern Cross University.
All right. So this was all about Diploma of Nursing, guys. If you have any questions, you can let us know and we can take the questions at the end of this discussion. So talking about the Bachelor of Nursing, this is the most popular, I think, the king of the courses. So everybody is asking what's the entry requirement and how can we proceed further for the full 3 years bachelor's program. So what are the entry requirements, Deepa?
Right. So Bachelor of Nursing, it's one hierarchical level above compared to the Diploma of Nursing. It's a level 7 bachelor's qualification, whereas the diploma is a level 5 qualification. And you can qualify to become a registered nurse here, right? So when it comes to entry requirements, of course, a year 12 is needed. Now, some universities also look for, in your year 12, have you done maths as a competency? Not every university, some university, depends on which university you're applying for.
So do you mean that you do not need to have a cognate background in that?
Yes. So you could technically come from any background, but maths as a mandatory requirement is something that some universities will look for. There's also some requirements like a mature age entry requirement. You must be at least 18 years of age. And there are other requirements in terms of police check and as well as vaccinations, because you will be entering healthcare facilities in terms of your clinical placement. So when it comes to English, again, IELTS 7 each, no bands less than 7, and PT 65 or in OET is also accepted, but they are allowed in 2 sittings. Yes, this high English requirement does exist for bachelors of nursing as well for the full 3-year program, and that will allow you to qualify as a registered nurse.
Good. So talking about those kind of people, Deepa, who don't have 7 each yet, and is there any pathway for them to apply for the Bachelor of Nursing?
Yes. So yes, there are options. So
Mhm.
that's why this session is called a masterclass for students who just are on the fringe of meeting the requirement. They're not yet. How can we still help them, right? So there are a couple of universities that are open to giving package options, right? So if you have a 6.5, if your IELTS score is in the 6.5 range or 6 each range, there are universities that are willing to give up to 40 weeks of English prep package with your Bachelor of Nursing. Many students are willing to dive into the nursing, but they really want to have the COE in their hand as a vote of confidence, right? At the same time, waiting till you get 7 each seems to be a trial in itself, right? Because you are still not secured your place to study the Bachelor of Nursing. So packaging options exist. So there are a couple of universities that does the packaging where you could study 40 weeks of English prep with them, leading to the Bachelor of Nursing. Now, very important to know that the English prep is also going to help you with your cracking that 7 each requirement,
Correct.
right? So in that sense, it is fully worth it, the time that you're spending on that IELTS prep. So there are options where students are looking for package options. There is also ways where you could package many students don't understand that when you study nursing, especially if you are from a very different, diverse background, a Cert 4 in individual support or a Cert 3 in aging support, these sort of courses are really good precursor courses.
Correct.
Because it helps you get acclimatized to the study environment, right? Because some of the same topics you will be studying at a very primitive level, right? So I always suggest that to do this as a precursor course, a student can even package like a future Bachelor of Nursing that's starting about 1 year later, but currently study like an individual support course, so that many students can start work as a personal care assistant. And by the time they complete their nursing course, they can then become a registered nurse or an enrolled nurse working within a AHK facility, which is so much in demand nowadays.
Yeah, so they have an idea while working as an individual support worker or PCA, that what they have to do in future. So it's good that they are actually adopting that environment and then studying something which is relevant to their future studies or future career pathway. That's very good. Excellent.
Yes.
For those people, Deepa, who have already completed Diploma of Nursing in Australia, they are enrolled nurse and they want to become a registered nurse. It's always good to be on the higher position in the end. So if they have already been granted enrolled nurse license and registration and they want to become a registered nurse, what is your advice on to it?
Yes, I always suggest students that while you have completed a Diploma of Nursing and become an EN, it is always good to progress higher. And because the pay scale, there's a huge difference when it comes to EN and an RN as well. So students can get up to 1 year of credit when you complete your Diploma of Nursing and hold your EN registration. Many students fail to understand this. It's not only about completing the Diploma of Nursing program, you also must have a registration as an enrolled nurse. In that sense, you do not have to provide your English scores again for the Bachelor of Nursing. You will directly meet the entry requirement, plus you will get 1 year credit. So the Bachelor of Nursing course will only become 2 years. So there are many universities that have an entry pathway called Bachelor of Nursing EN pathway, where they will be only doing it for 2 years.
Yes, that's good. So thank you so much for that information, Deepa. That's really helped, because we have students who have completed this. They want to see what pathway they have. They want to see how many credits they will have. But then again, understanding the entry requirements and the license requirement that you have to be an enrolled nurse during that time to qualify for the credits is very, very important. I would say the other common question is from the overseas nurses, Deepa. Most of the time they have completed a diploma or a bachelor's from outside Australia, and they want to get credits here in Australia. And to become a registered nurse here, you cannot you may not directly qualify for the registration. So what will happen then? What to do then?
Yes. First of all, Australia wants and welcomes nurses from varied backgrounds from different countries, because there's huge shortages in healthcare industry, especially when it comes to nurses, right? So there is a very vibrant pathway for overseas nurses who are looking to transition and to practice as an Australian registered nurse, right? In that sense, the students as long as there are few entry requirements that are met, the students can easily transition. Why are these requirements? Because healthcare, the infrastructure, the setup, the systems and processes from your home country will be very different from what is followed in a Western country like Australia. So they need to do some upskilling, right? So that is the reason why there is a transition pathway for overseas qualified nurses. So first and foremost, of course, English language requirement is primordial. So 7 each in 2 sittings or 65 each in PTE in 2 sittings is needed. Apart from that, you must have been locally registered in your country as a registered nurse. That means in your country, you must have completed a bachelor's of nursing or a master's of nursing that will allow you to become registered as a registered nurse in your home country. And there is also another requirement, which is called the recency of practice. That means you must have been a nurse who has practiced recently, which would mean at least minimum of 3 years of work experience in the last 5 years is also needed. But if you meet many of these requirements, then you will be able to get 2 years of credits based on up to 2 years of credits based on your Bachelor of Nursing qualification. So you will have only 1 year left to study. Right. So if you meet these entry requirements in terms of IELTS, in terms of your recency of practice requirements, in terms of your local registration, and I'll give this tip to all the students to also submit your course outlines, because the maximum credits is assessed based on your course outline, also called a syllabus book, right? So if you submit all of these documents, then it helps the credit transfer process. So there are many universities that are giving up to 2 years of credits so that the student has only 1 year left to do, which would then enable them to successfully transition into a registered nurse in Australia.
In 1 year only.
Yeah. So there are universities in Western Australia, there are universities in Victoria that are facilitating this pathway. But Hina, because there's so much competition to study nursing, even the places for this is limited as well. So let's say there are many courses in healthcare like nursing, they also have only one intake a year. So sometimes students wouldn't have any places for 2023 because it's already full, and they may have to wait till 2024 to do this, which is actually wasting 1 year. I also recommend to students to not be very hell-bent on credits. There are some universities that are open to give 1.5 years of credits instead of 2 years of credits. So you will have another 1.5 years to do. Because rather than waiting and wasting 1 year, I recommend students to go for lesser credits, as long as, it helps you successfully transition to become an Australian registered nurse. Yes.
Yeah, that's good. So we have talked about Bachelor of Nursing for overseas nurses. They can get up to 2 years of credits if they are qualified. Please let us know if you have any questions about it. We are happy to give you the customized information about your case, particularly. So, Deepa, sometimes we receive queries of the student. They don't want to do bachelor's degree, but they want to understand how outcome-based assessment is working. So, can you tell me a little bit about that too, please?
Yes. So there is, obviously, it is not that studying a Bachelor of Nursing with credits is the only option. For overseas nurses, they can take the OBA pathway, the outcome-based assessment pathway. It is a 4-step process where there is a self-check-in and an assessment is needed, as well as the main part, which is clearing an online exam called NCLEX, and then doing a practical exam in actually Australia, in Adelaide, called Aussizz. So students will have to undergo defined preparatory programs or self-prepare by themselves to clear these milestones. For example, the NCLEX online exams is not that easy to clear, so students may need some prep. There are providers that are providing these prep courses online, or you can come to Australia on a visitor visa to even do these courses.
Oh, okay. So you do not need a visa?
Because these are short-term ones, right?
Okay, so these are not course registered.
Right, yeah. Many students come on visitor visa, business stream to do these courses, especially to take the Aussizz exams, right? Because the Aussizz exams, which is the practical assessment that you would take, is in Adelaide, and it's the slots are very limited for that. And at the same time, it costs about $4,000, and the students are given a visitor visa to come here and take that test. So once you successfully complete all of these pipeline, then you will be eligible to then become a registered nurse. You can apply for registration with AFRA. So this is the other pathway for students who do not want to study and complete 1 year here. However, you will have to be at the top of the game, because these exams, you need a lot of prep to clear these milestones.
So do we have any preparation centers here where we can help students to take classes through us?
Yes, of
Okay.
course. There are many providers in the private space who are web providers who are running prep programs for NCLEX
Okay.
and prep programs for OSCE as well. And this is something that students can do if they're feeling underconfident about clearing those exams.
So do you know how much is the duration of that study?
It is about, especially for OSCE, 10 weeks to 15 weeks. Yes.
Okay.
Yes.
Well, 10 weeks and 15 weeks, it should be fine for
Yes.
the people who don't want to study another 1 year. But guys, let me tell you, this will be very, very difficult, or maybe very, very challenging for you if you haven't studied anything in Australia, because you don't know code of conduct.
Yes.
You don't know how to practice in Australia. So it's very, very important for you to understand how things work in Australia specifically.
Yeah.
So with my understanding, Deepa, the OSCE and NCLEX is the theory and practical?
Yes.
Okay, so
Yes.
they have to do theory
The NCLEX first.
yes,
Yeah, and then the practical,
NCLEX
which
as
is the final.
theory,
Yes.
and then practical,
Which is the OSCE.
okay.
Yes.
Okay, all right. Thank you so much, Deepa, for that. Last but not the least, Masters of Nursing is also getting very popularity at the moment, because many people who have come to Australia, sometimes they are from the cognate background, sometimes they are not from the cognate background.
Yes.
And they always ask for the option that I hold a master's degree and I want to change it to Masters of Nursing.
Yes.
So what are the entry requirements for them? And do they have to be in the cognate background, or they can apply still?
Yes. So this is something that is really like a frequently asked question at the moment, right? So certainly you can aspire to study Masters of Nursing, even though you're coming from very diverse academic backgrounds. So there is Masters of Nursing graduate entry courses where it is meant for students from other health backgrounds or even other diverse backgrounds like commerce, like accounts. So it is very much where universities are open to considering, right? However, students have to do some sort of prep here. So one of the main entry requirement is that you must have done some introductory units in biology and in anatomy, as that is an academic entry requirement for the course. So what I suggest students to do is these courses are also available online, about 2 months of duration, and it costs around $800 to $1,000. So first they must be willing to invest the time to study these preparatory courses in introductory biology and anatomy. And some universities, for example, Curtin also asked for an extra unit called research methods, right? So all of these units can be studied online. And at the same time, of course, the English requirement in terms of 7 each or 6.5 in 2 sittings is also necessary. But is it like this? If I am from, let's say I've studied pharmacy and I'm a bachelor's of pharmacy and I'm applying for Masters of Nursing, or if a student has studied Bachelor of IT and is applying for Masters of Nursing, is one from the health background given preference over one from the other background? That is not the case. If the program is meant for students from wider background to enter into nursing, one of the main thing is that Masters of Nursing programs allows you to register as a registered nurse general. So all of those courses leads to that outcome, even though it is just master's for 2 years, right? So one of the advice that I have for the students is to go to AFRA's website to really enroll in a program that is in their approved providers, approved programs list, because there are just Masters of Nursing 1.5 years course or a Masters of Nursing practice, but it is not accredited with AFRA. So they must check that. Obviously, qualified education consultants like us can help you check whether this program will lead to a registration or not, because there's no point in studying a program that will not lead you to a registration.
Of course, yes. The time, the efforts, the payments, whatever you are paying, it will be vanished. So always prior discuss your case with the expertise, and then decide what you want to do. One last question from me, Deepa. Sometimes people are telling me that they are not getting admissions because of seats availability. So do you have anything to share here? How seats availability work for masters specifically? Because I believe even though we can secure admission in bachelor's diplomas comparatively easier than masters. So
Yes.
Yeah.
Yes. So that is a very dire problem that you
Yeah.
pointed out, that there is not enough seats around, even though there is a huge demand in terms of
Mhm.
Masters of Nursing. So one thing that the students have to note is that the Masters of Nursing for semester 1, 2023 across Australia is full, actually,
Oh my
right?
God.
So students have to prepare well in advance and be ready with all of these entry requirements that I listed.
Mhm.
And that not to lose hope, there are a couple of universities that will have a semester 2 option. Semester 2, that would be July intake for Masters of Nursing.
Okay.
But you will have to, nowadays we prepare our list of candidates who are looking to enter nursing courses well in advance, so that if there is any cancellation or students who are not joining, then we can replace that student with this student, because there's so much demand. So I advise that not to be disheartened with the seat situation.
Okay.
Because one thing for sure is, if it's based on then, have you submitted a complete documentation, like everything included with the university? And the second thing is, first come first serve, when did you apply? So the minute for semester 2, the applications actually are opening as early as February 2023. So if you apply well in advance, there's a good chance that you would get a seat. But I will tell you, semester 2 is not as big as semester 1. So there could be hardly 100 or 150 seats across Australia. So it's very
Oh my
heavily
God.
competitive. Yes.
Okay.
Yes.
So in my understanding, for Masters of Nursing, you do not need to have in a cognate background student. However, there is a prerequisite requirements. The courses Deepa said is biology and anatomy.
Yes.
And sometimes in some universities, there's a research subject is also mandatory. So for the students who are looking to get admission in Masters of Nursing, they can be of any background. However, they have to complete that prerequisite units we discussed.
Which you can do it online.
Yeah,
It would
these
take
are
a
available
matter of 2
online.
months, but you can do it online as
Oh,
just.
it's 2 months only. So
Yes.
there is not much investment as well. You can
Right.
study in 2-3 months and
Yes.
complete that course.
Yes.
Um,
Just as a roundup, right?
Yeah.
Because if you are a nursing aspirant who wants to study nursing, that is why we term this session as a master session. No matter at what levels you would like to study, be it at a diploma of nursing where you do have the score, or diploma of nursing but you don't have the score, or if you're looking for a pathway program, diploma of health science leading to bachelor of nursing, but you still may not have the score, you're in hopes of securing it very soon, you have options. You can study Bachelor of Nursing, the full 3-year program, or if you've already studied the Diploma of Nursing, you can get credits if you've studied that in Australia and study Bachelor of Nursing, enroll nurse pathway. Or if you're an overseas nurse, you can enter the conversion program by getting up to 2 years of credits, so that you only have 1 year left. But if you are an overseas nurse who's looking to transition through the OBA pathway, we discussed how to do that as well. And finally, when it comes to Masters of Nursing, how even from a wide variety of background, how you can still crack the entry requirements. So the advice is to not lose hope, but at the same time, prepare well in advance and get advice from professionals, right? I guess, but the PR prospects are looking very promising.
Yes.
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 For be it for enrolled nurse or for registered nurse. There's huge occupation ceiling allotments from the Department of Home Affairs as well when it comes to.
And I recently went to an agent forum in the university side, and I got to know that in the general, from the mayor and other officials, Australian officials, they were telling about that they have invested a huge amount on nurses in health industry. So we are expecting up to 15,000 to 25,000 extra seats for the nurses, maybe in employment point of view, not as PR point of view, but then of course, if they have invested something, they are planning for 5 years ahead now. So we can expect that there will be more nurses, more demand, and of course more people will be required to become a nurse in the future. So it could be enrolled nurse, registered nurse, by masters, by bachelors, anything.
Yes.
So it's a good option for the students to avail.
Yes.
Yeah, we have some questions, Deepa.
Yes. So we will be going through these questions one by one, and we can try to answer them. Yes. So what about if someone is a permanent resident? Yes, that is a good question, Avdesh. Actually, in full disclosure, if you are already a permanent resident, then you will be a domestic student, and universities have a domestic international student domestic student recruitment team that helps with these things. But what I hear is also that they're not getting enough support in terms of getting their applications through, right? So you can contact us. We'll be happy to help. There are a few universities that are a bit faster in this regard, like Torrance University, for example. But largely, you will come under domestic students, and universities have separate teams to handle the admission process for these things. Skill assessment can be done as I have after registration number, and can skill assessment be done without experience for EN? I guess they're asking about EN skill assessment. In terms of if you have done the diploma of nursing in Australia, you specifically don't require a work experience to get your skill assessment or as a registration as EN. Work experience is not a mandatory component here, right? However, we are not migration agents per se, but we speak in terms of experience because we work at Aussizz Group. But you can contact our migration agents for further detailed advice on this. How about overseas qualified nurses? Yes. So we discussed this question in detail. So 2 pathways available. You can either go for a conversion program. Of course, local registration in your home country is needed. Unit outline is needed so that you can get maximum credits. IELTS score and PT score is needed. And recency of practice requirements, you must have some work experience requirement. If not, then you can go for the OBA outcome-based assessment pathway. A bit sooner, but a bit tougher as well. So you can choose what you want to do. If you have more questions, please write to us. We'll be leaving our phone numbers in the comment section here so that you can contact us if you have more queries.
Correct.
After graduation of Master of Nursing, do we need to do skill assessment from ANMAT for permanent residency? Yes. So, Mr. Hussain, remember we discussed about an approved programs list from AFRA. There are a few programs that are approved, which means that if you do that program without any work experience, without any further requirement other than the English, you can go for registration with AFRA and subsequently skill assessment with ANMAC as well. So you have to make sure that the Masters of Nursing is an accredited program and there is no work experience requirement. You can straight away go for skill assessment, right? Yes. Anand, yes. If as long as she's completed the diploma of nursing in Australia, there is no work experience requirement per se for the registration process, nor for which means license to practice. And the skill assessment process when it comes to nursing actually mirrors the registration process. So it is straight away if you get the registration, you are most likely to get the skill assessment as well. Any other questions? All right, guys. Thank you, Hina, for being a very involved host. Oh, we have more questions coming in. Yes.
Yes.
Is there any chance to get PR on enrolled nurse or registered nurse? Is must to do from Sydney. Now, when it comes to, we had a brief look at this. So if you are studying this course from NSW, then it did say that you have to be an enrolled nurse and mothercraft nurse, which is an extra add-on requirement, which may have work experience requirement as well. So we suggest that if you are in New South Wales, finish the Bachelor of Nursing program. But when it comes to enrolled nurse, the better PR option states are Victoria and South Australia, because we have seen in the last few invitation rounds where enrolled nurses did receive invitations in Victoria around 70, 80 points mark. Yes. And when it comes to South Australia, which is why many students move to study Diploma of Nursing in South Australia, because there the providers are full most of the time, because if you finish the course from South Australia, you are a graduate from South Australia, then as long as you have maybe 3 months of work experience in regional Australia or 6 months of experience in Greater Adelaide, then you will qualify for a prospective PR pathway for 190 or 491 in South Australia. So that's just an overview. For detailed assessment, do get in touch with our migration agents. Thank you. No, it's a pleasure to answer your questions. If you have more questions, please write to us. I'm just going to put our email. Request our social media team to put this in the chat box as well. So you can in touch with us. And can you add your phone number?
Yeah.
Yes. Thank you so much, and wish you all a very good evening.
Thank you so much, Deepa, for the lovely session. It was really helpful and informative. Thank you so much, everyone, for joining us.